So, one of the things, and of course, you'll have to, in the room, right? You're feeling into yourself. What do I really think is going on here?
Yeah.
But the point is that if these kinds of things are coming up, even if they're related to grief,
Yeah.
this is an area where we want to do assessment.
And there she is. Oh,
That was fun.
that was fun. Mommy enjoyed that. I enjoyed that. You were right behind the curtains. That's where you were. Hi, Heather. Thank you so much for being part of our third annual Innovative Child Therapy Symposium. I first met you in the Oaklander training, the virtual version, and I was just amazed at the connection that we formed. You are an amazing person in so many ways, but it turns out you have a lot of credentials with synergetic play therapy and the Oaklander model, a registered play therapist, and probably a gazillion other things. But what I really reached out to you for this symposium is your knowledge base on suicide ideation in the playroom with young children. And I
Yeah.
know many of us as therapists have stumbled upon this, and I really don't know of another source of training or information. So the fact that you've put stuff together is just so valuable and so fascinating to me. So we're going to talk about that. But before we do, I want to make sure that you just introduce yourself, tell people who you are and what you do.
Sure. So, my name is Heather Fairlee Denbrough, and I am a registered play therapist supervisor. I'm a certified synergetic play therapy supervisor. I've done a fair amount of the Oaklander training in Gestalt play therapy, which I absolutely love.
So good.
And I'm also a clinical supervisor and still practicing play therapist at a community mental health agency in Vancouver, Washington, the Children's Center.
Okay. Oh, you are a busy girl.
Oh, and then I do all my own stuff, which is my workshops and resources and whatnot under my business, Playful Integration.
So playful integration. And I think about like recently at the time of this recording, you posted that you have a training on suicide ideation in the playroom with little
Mhm.
kids. And I know I've had clients before, young children that had suicide ideation, and it's unsettling with any client, really, regardless of age. But little ones, what to do? Tell us what's important to know. I know we can't like do the whole training here, but
Right.
give us like the bird's eye view and then point us to what we need to know more.
Mhm. Well, I think the first thing that most folks need to know about this really is that even very young children, much younger than we would think, can experience suicidal ideation and even make suicide attempts.
Mm,
So, this is something that's really important for us to know. Even kids who are as young as 4 years old, there's evidence that they can start to really understand that death is final,
mm,
so that if we kill ourselves, it means something.
mm.
Right?
So there's this comprehensive, like they know, so there truly is a danger there.
Exactly. There truly is a danger there because even little ones start to understand that. And by the time that most kids are in about third grade, they can give a pretty accurate definition for what suicide is.
Okay. Okay, so they understand what would we see in the playroom? Would it come out in themes of play or like
Mhm.
explicit? What would it look like?
Yeah. So, there's kind of like this group of sort of warning signs. So things that we would be looking for kind of as we're getting to know a child, right? Or that as we're talking to parents. So have they had any the same as older kids and adults, history of violent events in the past or previous attempts to hurt themselves or kill themselves. And then things that we're starting to notice more in the playroom is if you see sort of that really high impulsivity,
Yeah.
or I almost call it like being a daredevil,
Okay.
excessive fun seeking. So kids who climb up on top of things that they really shouldn't be climbing on, that moment in the playroom where you have that, oh no, sort of feeling.
Oh,
So
I
paying
felt that
attention
just you
to that.
saying that.
Right, you felt it. Yeah.
Yes.
So if they're doing things like scratching themselves, biting themselves, that kind of aggressive stuff, hitting their head on things or hitting themselves in the head, or if you're noticing that kids are the kind of opposite of that fight or flight, if they're really, really shut down.
Yeah. Like
So if
dorsal vagal,
they're,
like just
mhm, yep, that
flat.
dorsal vagal state. So we're not really able to communicate verbally very well. We may be really sort of depressed or lethargic frequently.
Mhm.
Sometimes I get a little concerned about kids who come into the playroom, but they just seem too tired to play or too
Mm.
depressed to play, right?
Yeah. So that
So that,
shutdown, the numb, the
mhm,
presentation of dorsal vagal in the really young children. So
yep,
that's like a warning sign. All of those are
yes.
warning signs. Okay.
Yep. And also, if they are saying actively suicidal things like, I'm going to kill myself, I'm going to jump in front of a car, or if they're saying passive suicidal things like, I wish I was never born, I wish
Mm.
I was dead, right? And we can't assume, because sometimes folks assume that those are just things that kids have heard from like older brothers and sisters,
Yeah.
and that so they don't mean
Exposure to
anything,
something.
but that's
Mhm.
not necessarily the case.
So they don't
Mhm.
necessarily take it seriously, and that
Correct.
could be problematic. That could be, I guess, a
Yeah.
warning sign that we overlook.
Mhm. And then the other like really big piece of it for us as play therapists is that frequently for kids who are experiencing suicidal ideation at a younger age, we see kind of a preoccupation with death
Yeah.
in their play.
Hmm.
So, what does this look like for little ones if we are in the playroom and we're noticing, okay, there seems to be a lot of, and then this person died, and then this person died. Oftentimes it might seem like it isn't very redirectable or there's no other, so sort of that focused in almost like traumatic play
Hmm.
where a child is doing the same thing over and over and over again and it feels like there's no way out of it.
Like a
So that
loop, like a
sense,
perseverating on it.
mhm,
Like that's
yep,
the
so
theme, and it's
perseverating on it.
not moving.
So also themes like cemeteries, people going to heaven, repeatedly talking about people who've died in their own family,
Yeah.
sickness, accidents where people die or where people can't be rescued or saved. There's nobody there to help them,
Oh,
right?
okay.
I'm going to take a breath here because this is
Yeah.
heavy stuff, right?
It's heavy. One thing that's coming to my mind, Heather, is like some of these things could be attributed to grief. How do we know when
Mhm,
it's, how can we differentiate between
mhm,
something that's just kind of presenting as something that they're working through, or or suicide ideation, something that we need
mhm.
to take action on?
So, one of the things, and of course, you'll have to, in the room, right? You're feeling into yourself. What do I really think is going on here?
Yeah.
But the point is that if these kinds of things are coming up, even if they're related to grief,
Yeah.
this is an area where we want to do assessment.
Okay. So
So, we
take
want to be
action. We need
checking
to.
in with kids. If we're seeing pictures of them, they're drawing pictures of themselves getting hurt, or they're acting out some kind of suicidal gestures. Even if we think it might be related to grief, we still want to be checking in. What does that mean?
Mm,
Right? So we want to check in. What does it mean to
curious.
die?
Yeah.
And see, do they know? Are they able to respond in a way that makes sense? Do they understand what it means?
Hmm.
Do they understand that it's final? Right? Because some kids will say things like, well, I'm going to die. Well, what would you do after you were dead? If they
Mm,
understand, they'll say, well, nothing because I'm dead.
hmm.
Or if their family believes in heaven, they might say, well, I'll be in heaven. So that's an understanding that makes sense. But I've definitely had kids say things like, well, then I would go to McDonald's. So
Okay. Okay. So
there's
it
a big
gives you like
difference.
a understanding of where they're at on the whole thing.
Yes.
Yeah. So it sounds
Yes.
like curiosity is a big thing and kind of doing like
Yes.
the child version of the suicide
Mhm.
risk assessment.
Yes, exactly.
Okay.
And you can use that same acronym, that SLAP acronym,
Okay.
for
That's the one
younger
I'm familiar
children
with.
too.
Hmm.
So what we're looking at there is specificity. So what I was just saying, have you thought about what it means to be dead?
Hmm.
Right? So we're trying to get them to get specific. How do you think you would become dead? Right? So
Mm,
then we have, if they have, that gives us, does this child have an actual sort of idea of how that might happen?
yeah.
Or would they say something like, this is a hypothetical, but close to something a child has said to me, well, I would go and find some lava and step into it.
Okay. So,
Not really very realistic.
okay. So would it be like lethality? Like,
That's the
is,
next one. Hmm.
okay. So would
Yeah.
this actually lead to death? Okay.
Yes. So that's what would happen to you if you were dead. What could you do if you were dead? We want to see, do they understand that death is lethal?
Okay.
And do they understand the finality that it isn't something you can take back?
Oh, this is such heavy stuff. I'm like feeling like you were a minute ago. And I think
Mhm.
just to normalize it, this is what happens in the playroom too. When we see
Yes.
that, it can overwhelm us. Like if I like even in the
Yes.
video, I see my eyes starting to get red and my face start to
Mhm.
kind of flush.
We are going to feel this when it comes up.
Yeah,
And we want to be really attentive, like you and I are being, Jackie, to what are we feeling?
yeah,
What's coming up for us? There's often this rush of sadness that just pulls you up through your
yeah,
chest,
yeah.
right? So we want to be attending to ourselves so that we can stay regulated so that whatever the child needs to bring in, they know it's safe to bring in.
Girl, yeah. And I do
Because
want
then
to
they can
say,
go there.
yeah, then we can hold that space. A lot of stuff I learned from that intro version of this energetic play therapy, I think comes in helpful with this
Mhm.
heavy stuff because
Yes.
I think before I had that training, I wouldn't have necessarily known what you just described.
Hmm. I agree.
So that's helpful to have some, I mean, if you're
Mhm.
working with clients that have um, some difficult circumstances that would lead to this. I mean, it can be in anybody's, day, but having that higher level training or even just an intro training for
Yes.
synergetic play therapy can be very supportive.
Yes. And there's actually, if folks even want to dip their toes into SPT in an even smaller way, there's a 3 hour, I think 2 hour video course
Oh,
called Aggression in Play Therapy.
oh,
And that
okay.
was my intro sort of to SPT. I took a day-long workshop with Lisa just on aggression and play therapy.
Lisa
And
Dion.
that yeah, with Lisa Dion. And that very directly led me to this work on suicidal ideation.
Oh my gosh.
Mhm.
Wow. Okay. Okay, so that's some big stuff and thinking about
Yeah.
like we can have the skills to actually help with this. So
Mhm.
we're at the
Yes.
L, looking at the
Yes.
lethality
The
and what
lethality.
that
So
looks
what
like
could you
assessment wise.
do?
Yeah,
What
okay.
could you do if you were dead? And then it's access. Does the child have access to weapons or means, right? So that's checking in with, are there any guns in your house? Where are the knives in your house? Some kids are going to be like, I don't know. But the kids who know, they know. So
Yes,
that's an important piece. And also that's a piece where you want to check in with the parent. And I should say all of this,
yes.
especially with young children, parents involved as much as
Yeah.
possible
Okay,
for the
safety.
safest possible outcome.
Yes.
And I'm going to talk about, oh, in the last one, prior attempts. So have you tried to hurt or kill yourself before?
Ooh, okay. Okay.
Hmm. And then the piece I want to move into too is that working with parents around this, for me, the most important piece of it is to be able to sit with the parent like we are now,
Yes.
noticing and naming all the dysregulation, the
Hmm.
distress, the sadness, the fear that comes up,
Yeah.
right? So that you can teach the parent to stay as regulated as possible.
Ooh, be the external
Because
regulator.
if they
Yeah.
check in directly, this is the thing we want to teach parents to do. We
Okay.
want to check in directly
Mhm.
with a child. Have you been thinking about killing yourself?
Oh, very clear. Very,
Very clear.
yeah.
Because most folks think that if we mention something like that or we
Yeah.
name it, it's going to pop into a kid's head.
Mhm.
Not true.
Okay, so that's
So that's a myth about suicide, right?
okay.
And that's actually a myth for everyone, not even just kids,
Okay.
right?
Okay.
So, but the truth is that if we name it directly,
Yeah.
so many things happen. Oh, all of a sudden, it's not a secret.
Mm.
It's something that can be openly talked about,
Oh.
right? So then we know it's something that we can seek help for because everybody already knows about it.
Oh my goodness. So that's hope there. They're not alone in their suffering anymore.
Yeah.
So just asking that question doesn't make them want to go out and it doesn't create the suicide ideation, but
Oh,
it can access it to where we can pull
mhm.
it out and help them with it.
Yeah. And if you ask a child who doesn't have suicidal ideation, have you ever thought about hurting or killing yourself? Most of the time, they look at you as if you grew another head.
Okay.
They're just like, what? I mean, I've had kids go, what?
So you can really
No.
determine whether yeah, that's the assessment piece of
Mhm.
whether there's active suicide ideation or not.
Mhm. Yeah. And
Oh,
that's the piece. We want to be super direct as therapists, and we want to be teaching parents to be really direct
mhm.
because that is one of the most protective things we can do for little ones who may be experiencing suicidal ideation.
Okay, super direct, clear.
Mhm.
And the SLAP is specificity. That's a lot to
Mhm.
say. Specificity,
Yeah.
lethality,
Mhm.
and access
Mhm.
and prior attempt.
Yep,
Okay, and then you say it very
exactly.
direct, very much
Mhm.
in kid language, and you're saying like even as young as 4, they can
Mhm.
present with ideation
Yes,
and even be at risk for potential attempts.
yes, yes. And, some kids are, just to pull in a bit of social justice knowledge here too, Black children are at a much higher risk for attempts and for completing suicide than white children or any other racial group.
Oh,
So that's something else for us to hold and keep in our minds as we're working with Black children, that that's something that is more of an issue for them that we want to really be paying attention to when we're working with little ones.
okay, okay, so having that cultural knowledge of
Yes.
whether they're children of color or whether they're just, whatever their culture is, like
Mhm.
having that integrated in there.
Yes, absolutely.
Oh, Heather, this is so helpful. It's overwhelming and helpful at the same time, and I think about, like, the power of this knowledge just could actually save lives.
Yes.
So, okay,
Mhm.
so we're almost out of time, but I wanna make sure I know you have, like you people can go deeper with this, which
Yes.
is, like, great. I'm gonna take your full training, but just thinking about gosh, it's kind of hijacked my thought process, to be honest. It's very kind of overwhelming thinking about it. Where can people go to learn more from you and to kind of further their knowledge on this? And I'm gonna put the links below this video as well.
Sure. So, my full recorded workshop, it's a 1 hour workshop on young children and suicidal ideation in the playroom. It's available on demand on Lynn Wonder's new Wonders Counseling online school for mental health professionals.
Mhm.
It is $29.
Ooh, that's
And
a good price.
yeah, and with it, so you get the 1 hour workshop. You have lifetime access to it. You can watch it whenever you want, however many times you want. And then you also get a handout that I created that is prevention plan strategies
Mm,
for young children. And
mhm.
so this is a massive list of strategies that you can use when you're in that moment where you're trying to create a plan for safety
Yeah,
with a parent and a child who is little, right? Because we're trained to do that, but we're often trained to make those plans for older kids.
yeah.
And a lot of those things they just don't apply to our little ones. So
Mhm.
this is a list of prevention plan strategies that is for young children specifically.
Oh my goodness, that's fantastic. And it's only $29.
Mhm.
Oh, that's fantastic. Okay, so Lynn Louise Wonders, we'll link her website there and a link to the Synergetic Play Therapy site and whatever else you give me to put down below
Sure.
the video. Thank you. My goodness. And I do want to say you're a really good teacher.
Thank you.
Like, yeah, I feel like I feel more resourced now. I feel like I have something to
Oh,
go on. I do feel activated, just kind of thinking of clients in the past that it's real
yeah,
stuff. It's something it's heavy stuff. And I
it
think we
is.
need to honor that sometimes when things dysregulate us, being the external regulator, just like for the parent can be
Mhm.
hard. And
Yes.
helping the parents out, help, make sure we seek out consultation or
Mhm.
supervision when
Yes.
stuff comes
And
up.
that is, that would be my last piece of it is if you have a kiddo who is experiencing something like this, or you even think they might be, please access your supervisor,
Yeah.
access consultation, whatever you need to feel resourced enough to do that.
Yeah.
Reach out for, like, just like we tell kids, reach out for help. You
Yeah.
have the whole play therapy community behind you. Like somebody's there.
Yeah, it's filled full of, like, loving people like yourself. Gosh, that made me emotional. It's kinda late when we're recording this too, so there's probably many variables. But do you do consultation? Do you have that?
I do, yes.
Okay, so we'll put a link below to, you as well, and, I know, there's so many others too, so, definitely, in the Facebook group, we can always kind of, put some fillers out there if you need consultation on anything, people can kind of post like, "Hey, I'm looking for a supervisor or a consultant that
Yeah,
can
absolutely.
help me in this area." Well, thank you, Heather. As always, I'm amazed by you.
Thank
This has
you
been
so much,
wonderful.
Jackie.
All right, you take care.
All
Bye-bye.
right, thank you.
And there she is,